What is Silexan? Silexan is a branded extract of lavender oil developed by Pharmaceuticals in 2002. It consists of 71% linalool and linaloyl acetate, with over 100 trace compounds making up the remaining 29%. Silexan is licensed for anxiety treatment in 14 countries and is available over-the-counter as Calmade in the US. What are the main pharmacologic properties of Silexan? Silexan's properties resemble conventional medications. Calcium channel inhibition, similar to pregabalin, GABAergic effects like benzodiazepines, NMDA antagonism like ketamine, and serotonin 1A agonism, similar to buspirone and vortioxetine. The most relevant mechanism is its serotonin 1A agonism, supported by animal studies. What is the best evidence for its effectiveness? A large randomized double-blind controlled trial with 539 participants demonstrated that 80 milligrams and 160 milligrams daily of Silexan were significantly more effective than paroxetine 20 milligrams per day and placebo on the Hamilton Anxiety Rating Scale, with a p-value of less than 0.01. The study found Silexan to be superior in reducing anxiety and improving secondary measures like sleep quality and depression. How do the doses compare in terms of efficacy, and how do they compare to benzos and SSRIs? Silexan's 80 mg dose had an effect size of 0.4, and the 160 mg dose had a 0.5 effect size. Benzodiazepines generally have higher effect sizes ranging from 0.8 to 1.0, indicating greater short-term efficacy. SSRIs and SNRIs like paroxetine or sertraline typically show effect sizes between 0.3 and 0.5 for anxiety, similar to Silexan. This comparison positions Silexan as a moderate option that offers the benefits of reduced side effects and no dependency risk. How soon do benefits become apparent? Benefits from Silexan typically appear after 2 weeks, with full effects developing over 3 months, faster than some SSRIs or SNRIs that may take 4 to 6 weeks to show significant benefits. Is Silexan associated with withdrawal effects or dependency? No, Silexan is not associated with withdrawal or dependency. Unlike benzodiazepines, which carry a significant risk of dependency, Silexan can be stopped without withdrawal effects. This makes it a safe alternative for long-term use. What are the side effects? The most common side effect reported was lavender-flavored burping. Rare instances of sedation were noted but are minimal compared to the drowsiness associated with benzos. Are there any known drug interactions? No significant drug interactions have been reported, but continued research is recommended to confirm this. How is Silexan administered? The starting dose is 80 milligrams at bedtime, with the option to increase to 160 milligrams after 1 week if needed. Most patients with moderate to severe anxiety benefit more from 160 milligrams. Is Silexan safe for children? Silexan should be avoided in individuals under 18 years due to potential estrogen-like effects and rare cases of gynecomastia. What evidence supports its use compared to conventional anxiolytics? In a comparative study, 80 milligrams per day of Silexan was found to be as effective as 0.5 milligrams per day of lorazepam after 6 weeks in GAD patients, showing it can match the efficacy of low-dose benzos without the dependency risk. Is Silexan effective for other conditions? Silexan has shown effectiveness for mixed anxiety depression and subsyndromal anxiety, with a medium effect size of 0.67 in general anxiety and a large effect size of 0.87 in GAD-specific trials. Does Silexan improve sleep? Yes, Silexan has been shown to improve sleep quality as a secondary benefit of its anxiolytic effects, unlike many SSRIs that may disrupt sleep patterns. What precautions should be taken when using Silexan? Patients with estrogen-sensitive cancers should use Silexan only with oncologist approval due to its potential weak estrogenic effects. What does the FDA say about Silexan? The FDA considers lavender oil safe for consumption, and NIH supports this stance with no significant safety concerns except for its weak estrogen-like properties. What is the half-life of Silexan? Silexan has a half-life of about 9 hours, suitable for once-daily dosing. How is Silexan regulated globally? Silexan is a prescription medication in 14 countries for anxiety and is available over-the-counter as Calmade in the United States. What are its main mechanisms of action in anxiety? Silexan acts primarily as a serotonin 1A agonist, which is considered the most relevant for its anxiolytic effects. It also has GABAergic and NMDA antagonist properties that complement its efficacy. What do clinical experts say about its use? Experts, like Dr. Chris Aiken, note that Silexan works well for generalized anxiety disorder. Many patients who were on long-term benzodiazepines reduced their intake after starting Silexan, showing its efficacy in reducing reliance on traditional anxiolytics. What should patients expect in terms of treatment duration and outcomes? Most patients experience anxiety relief for several months even after stopping Silexan, with symptoms gradually returning if not continued. Using simple anxiety rating scales can help track the effects and determine ongoing needs.